Hi guys, it's a dental assistant tutor, and I ran out of space on my phone, so this is part 2 of the crown prep. So when you give the patient the temporary crown and it's all done, what you're going to do is tell them not to eat anything sticky or chewy because it's going to pull off the temporary crown. And remember that space is important and they have to have it on there. If they're out of town and they don't have no temporary cement, they can either go to Walgreens or a store that's a drugstore and pick up a temporary cement. It's in the toothpaste aisle. Or they tell them to use toothpaste, put it inside the crown and place it on the tooth, and it will harden. Or what I like to do when I worked for Dr. Kelso was take, and Dr. Dean, just a bunch of dentists, but I used to take the instructions that I wanted to tell them how to put it back on. I would type them up at each office I worked at because the other assistants didn't do it. And then I would take a small sterilization bag about this big, one micro brush, one 2x2, one mixing pad sheet, just a sheet. And then, you know, depending on your office, if they let you order the temporary cement packets that are samples or single use, they don't need to use the whole packet to re-cement the temporary. They can paper clip it or staple it and fold it in half and use the rest if it comes off again, because they have to wait 2 weeks. So you would put that in there with the instructions, and then on the instructions I would tell them, and same for you, because I would do this, is when you're trying in that temporary crown and you know it's facing the buccal side, take a number 2 pencil, mark it on the cheek side, so when you take off the temporary, you can look at it and know which side was facing the buccal, which is towards the cheek. And then when you clean it, it will come right off, or when they brush their teeth. And then make sure you have that appointment made if you didn't make it while you're waiting for them to be numb. Okay, so you have all that set. You make sure you walk them out to the front. Don't let them bypass the front office, because they do have to, you know, pay their portion of the crown prep. You're going to make sure you send it off to the lab. Call the lab, tell them you have a pickup. Most places you have to call them, or they just have a time they stop by. If you know the lab lady or person, the driver, is on their way, or they just left, I would call them and say, can you come back just for a moment and pick this up? Or can you wait a moment if they're in the office and you're finished up a crown prep? Because the sooner you get it out to the lab, the sooner it can get made. That's unless they use a CEREC machine, which I have a video on the CEREC machine also. That's a crown prep and crown seat all in one day. It's amazing, especially with the new technology that they use. You got to check it out. So that is it for the crown prep. Then you start cleaning up your tray. Remember, these tips, throw them out, put a fresh one on. Don't leave the dirty one in the drawer, and have it ready to use in case you need it, or your boss comes in on the weekend. Everything's ready to be used. So they come in 2 weeks later, maybe 7 days, depending on the lab company and how much time they need to make the crown. They come in, and before you even take off that temporary, make sure you check the shade with the teeth that are next to it. So take the crown off the die-cast model. This is a die-cast model, okay, because the color. Take it off and compare it. Show it to the patient, especially if it's a central tooth. Okay, you got to make sure, especially if it's just one central tooth. That really can stand out. And if the shade looks great and the temporary is still on, remove the temporary. Then how you remove the temporary is you take either your spoon excavator, okay, the one that looks like it scoops, like that. And you take that, and you take your hemostats. I like using the hemostats, okay? And what you're going to do is you're going to grab that temporary off the tooth. So say it's right here, you're just going to gently grab the temporary and wiggle it back and forth, making sure it doesn't fall down the throat, and take it out. Then you're going to take a scaler. Now, the patient is not numb. They do not need to be numb for a crown seat appointment. But some patients are more sensitive than others, and sometimes they end up needing a root canal after having a crown prep. If that wasn't the reason why they needed the crown prep, was because they had a root canal. So you're going to take the scaler or the explorer and you're going to go around the gum line and make sure you clean it really good all the way around. I would not put air on the tooth. It could be sensitive if it has not had a root canal. Now, once you've cleaned everything up, sometimes some dentists will use Hemoseal or some type of cleaner to put on a microbrush and just wipe the tooth to make sure it's nice and sterile. Once that is done, then you get to start trying on the crown. Some dentists will do it themselves and some will have you do it, and there's a Nemo effect. What I mean by that is, what you're going to first do is try it on, and you're going to check the contacts. How you check the contacts is you have the permanent tooth on, okay? Don't force it on because it may not fit just right. You're going to take your floss and you're going to floss between the teeth. If it pops down, then the contacts are great. If it just goes straight down and it's loose, then someone's going to have to add porcelain to the crown. If it's the lab or if you can do it in the office, the dentist will do that. They have a little oven that they can bake the porcelain back on. Also, what they can do is, if it snaps, if it's too tight when they do that, they can do a couple of things. I like the old trick. You take a little piece of articulate paper, you rip it off, you put it on some hemostats, and you slide it in between the teeth, and you put the crown on. Once you have the crown on, you hold the crown in place and kind of tug a little bit, okay? That's going to leave a mark where it's hitting high on the crown, the permanent crown. You very carefully take off the permanent crown and check in approximately if there's any blue markings. You can go ahead and adjust that just a little bit on each side. Take a little bit each time and explain that to the patient. Go ahead and try it back in with the articulate paper and the floss. If you got great results and the floss pops, you're done with checking the contacts. But if it happens again, you might have to do it a few times, take it off, and adjust it. The patient will understand. So once you got the contacts just right, you're going to make sure that it's seated all the way down, okay, to the gum line. If that looks good, and you can take the Explorer, your Explorer, and with the crown on there, you're going to feel it. And this is on the patient's tooth. And hold the crown down. You're going to feel it. See if it's flush up against the buccal tissue and the rest of the crown. Okay? If that is okay, then you can start checking the bite. But for some reason, it's not seating all the way down, then it might be high on the inside of the crown. This is where your dentist will ask you to grab the Clue. It is a green spray that you spray inside the crowns. When you spray it inside that little crown, you're going to take it and put it on the tooth. You're going to spray it. I don't think I have any in here, but I don't. But what you would do is spray it right inside. This is a bridge, so I would spray it inside. And then you would place it back on the patient's tooth. When you take it off, anywhere the green is not there, that's where the tooth is rubbing up against it and taking the Clued spray off. Take a handpiece, adjust it, do it again. Repeat until it seats all the way. Once it's seated all the way, then you check the patient's bite. This is where it's important to make sure that they are not numb, and if they are, it's going to be a little difficult. So once again, once the numbness goes away, you have to let them know that they can come back to the office to get an adjustment. So you do it a few times, And you ask them with their tickling paper, bite down, tap, tap, tap. And what I do is when they're biting down on their tickling paper, you have this in the mouth, okay? What you're going to do is you're going to have them grind around up and down. And sometimes when the dentist is telling them that, I'll pull my mask down and demonstrate what the dentist is asking them to do, because they're so upset, maybe because they're even in the chair, that they're not thinking straight laying back. So I'll kind of say, go like this, especially with kids, you know. So when they're doing that, then go on the other side. Now, even though we didn't do nothing to the opposite side, when they have that temporary or that permanent crown, same thing for the temporary, but once they have that permanent crown in place and they bite down and you tug, if it doesn't come out, then it's not high. If you have to tug on it, then the bite is perfect. You can also use Shim Stock. It looks like tin foil. It's a very tiny piece of foil, and it's in a little clear box with a white backing. A lot of dentists use that with a pair of cotton pliers to have the patient tug down. It's the same technique. If it slides all the way out, then it's high. Take the permanent crown out, just like you did with the temporary, and ask them, does your bite feel the same with it in as with it out? If they say yes, then you're good to go. And you can polish it up with a polishing burr. Check your dentist which burrs he likes you to use for crown seats. Once you do that, it's pretty simple from there. You go get the dentist. Legally, they have to cement permanent crowns. And with that being said, you would use either permanent cement in a syringe that looks almost like your temporary cement, so always read the labels, or you might have to mix it up or put it in an amalgamator. Either the case, you want to line the crown, not overload it, line it. And then you're going to take either the crown or the bridge, and you're going to either place it in your palm, down like this, with your gloves on, and hand it to them, and they're going to pick it up and maybe wipe up the excess glue and place it in the mouth. Now, there's another way. You can just hold it on your finger like that so they can grab it a little easier. Either way, you have to hold it and have it ready as if it's going to be in the mouth. So if you know on a bridge that the molars are facing this way, well, you know in the mouth the molars are facing that way. So turn it in your hand as if they can just pick it up and put it in the mouth. Once they put that down, they're going to need the Marin Explorer to clean up any excess. Some cements you have to wait a few minutes, it'd be best. Otherwise you make a bigger mess. Or you can just go ahead and start cleaning it up with a micro brush or a scaler and then light cure it. But before you do that, what do you have to clean? That's really important. In approximately. So make sure you take the floss, you tie a knot in your floss like so, and then you're going to floss. Okay, pull it out, and that's going to pull out the chunks. That knot will pull out the chunks